This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Hello everyone, you are watching the Business Portal, your gateway to business trends and opportunities. Hello again everyone, I'm Mary Beth Nave and welcome to The Workplace, where we discuss a lot of concerns and up-to-date information regarding the industry today. So you know what, a lot of you have been asking about retirement homes and of course healthcare, home healthcare. So again, we have invited the director of the Retirement Healthcare Coalition, and there's a lot of updates that we're going to be talking about nursing homes and home healthcare. So ladies and gentlemen, please welcome to The Workplace none other than Mr. Marc Daubenbuechel. Hello Mark.
Hi, good afternoon.
Hello, you know, it's great to have you back. Every year we have you as one of our constant guest speakers and resource persons because again, this is one amazing industry that everyone needs to get updated on. So could you tell us again from last year, what is the latest and the greatest from RHC?
Okay, I think I can fill now 1 hour of program. So thank you for having me here the third time. I believe it's the third time. If you look what's currently happening in the industry in the Philippines, the biggest development that we see at the moment is home healthcare services, as well as nursing homes. We talked about in the recent 2 shows a lot about bringing foreign retirees here, bringing medical travelers here.
Making the country, the Philippines, a retirement hub.
Correct. And this is what the Retirement and Healthcare Coalition is still focusing on. But we believe that it's also time to look at the Filipino market itself. So currently we have 7 million elderly in the Philippines. Elderly meaning above 65 years old. The situation is that we have 140 geriatric doctors. We basically have no geriatric nurses. They first need to be trained extensively, and I want to discuss with you today maybe what we can do, where we can go, how we see the developments.
Perfect. Okay, so let's start first with when you say nursing homes and home health care. Are we talking about typically if you have a family member who's 65 and up, you have your brother and sister at home and they're taking care of that family member. What do you mean by home health care?
Okay. Home health care helps you in your home to take care of the elderly or of somebody who had a stroke or who had a heart attack. So you're at home, there comes the car with a nurse or 2 nurses, and they basically come in the mornings, lunchtime, in the evenings, and assist you for whatever professional help you need. You can have a 24/7 caregiver at home, but mostly they don't have the professional knowledge. So the home healthcare service provider assists you professionally with the elderly. If you look at a nursing home, you would not bring an active person into a nursing home. A nursing home is for people that are bedridden or that have Alzheimer's or dementia. So it's not like a senior residence, it's more or less the people are mainly in their bed already, or they are still walking around but have the tendency to forget what they have been doing 5 minutes ago.
Oh, so it's ideal when you have a family member who has either Alzheimer's or extreme conditions to actually be brought to a nursing home because there's a supervision that's being provided for.
Correct. If you look at what's currently happening here in the homes, usually is you have a caregiver that takes care of the elderly at home. But most of the time this is not professional. They have not been trained in this, and especially when the state worsens. Other people get, you have Alzheimer patients that get aggressive or they run away, they endanger themselves, they endanger other persons. That's usually when they are brought to a nursing home where they can be professionally assisted. Whereas the home health care assists you in your own home but usually the stage is not so severe.
Severe. Okay. How many nursing homes do we have in the country?
I would give the number, it's somewhere between 20 to 30 privately operated nursing homes. Privately operated nursing homes on a pretty good level. If you look at Europe, usually you have like big buildings, 500
Yes.
beds, and
Yes.
you're just a number inside. Whereas here in the Philippines, the operators rent family homes, somewhere between 6 to 8 bedrooms, and you have a maximum of 15 to 20 people living inside. And it's a family atmosphere.
Really?
So you have elderly having lunch together at the table. You have still like social activities for them. In the evenings they watch TV together. So it's not what you basically look at in Europe.
So it's not like a typical hospital environment,
No,
nothing like that?
absolutely not.
Okay, so again, anyone would be very comfortable with these places. A lot of people do have this question, where can they find a legitimate being operated, what do you call this, nursing home? I mean, what website do they go to?
At the moment, you can do research. There's several good operators in Manila, in Cebu, and in Iloilo. You can do your own research online, but the best thing is go inside, talk to the operator, and develop a feeling. You will feel if it's a good environment or if it's not a good environment.
Right, because of course the concern of any family member or any loved one is you're going to be leaving your, the person that you love very much in a nursing home, and you don't know what's happening inside. And of course, usually their concern is what kind of care they actually
Correct.
provide.
I mean, you also don't know that when you're working and you have the caregiver at home.
That's
you
true.
also don't pay. But what you can do upon request, several nursing homes offer CCTV. So you can check anytime you want. You can check from your computer what's happening in the bedroom of your loved one.
Okay, so that's usually what happens in a nursing home. And for the home health care, again, there are a lot of people who've been asking us these questions, such as how do they get in touch with a particular nurse? There are those who they have zero connections. They think of going direct to the hospital and hiring a nurse from there. Some don't know if they should go straight to a fresh graduate to manage, a loved one at home. How do you go about it?
Go to Google, type in home health care, and you will find a big home health care provider in the Philippines, or talk to the nursing homes, because these nurses have already experience, and usually the nursing homes are also willing to offer home health care. But what you look at, usually the typical home health care is not 24/7. You can have a caregiver, yes, but you'll have a nurse coming in 2 or 3 times a day doing the change, for example, of the, if you have wounds, you do the change of
the gauze.
The gauze, for etc. They make the prophylaxis that you don't get bed sores, because usually the caregivers don't know that. That's why you have a professional guidance from this nurse, and she can also advise the caregiver on what she should do and what she should not do.
Okay.
And the home health care provider can also provide you with the doctor. Once a day, twice a week, once a month, it depends on the need. But what's important about a home health care provider, he will provide a care plan. The geriatric or the caregiver can never do that. You have somebody professional coming in saying, okay, this person needs 2 times a day assistance. She should see once a week a doctor, and this is the test that we recommend. And usually that's all done in the home of the patient.
Okay, and usually which is more expensive though? Because a lot of people and families always, it boils down to cost as well. So which one would usually be more expensive? Which would be more
Usually
affordable?
the cost is almost the same.
Oh, really?
Because you have travel costs, and especially Metro Manila, the biggest problem we were just talking about, it is traffic.
Yes.
So
yes.
transportation is expensive, which you don't have when you have the resident in the nursing home. If you have a visit of 2 times a day scheduled at home, you can say it's almost the same cost like what you have in a nursing home.
Okay, and usually how much should, like let's say a family set aside if, for example, a loved one needs to be checked into a nursing home, or they actually are thinking of having home health care done?
Double occupancy starts somewhere at about 30,000.
Okay.
But there is no range going up, because you can have a private nurse in a 2-shift system, in a 3-shift system. It really depends. And if you look at the cost in a nursing home, what is covered, that's the accommodation, electricity, water, and then the food, and then the basic care. Medicines, of course, you need to pay by yourself, the family then, and if there's additional doctor visits, it also needs to be paid.
Okay. So that's 30,000 on a monthly basis.
That's where the price range starts. Correct, yeah.
Okay.
But if you think, how much do you pay in a hotel, right?
That's true.
30,000 usually Metro Manila minimum a day, and if you look at 30,000, that's 1,000 pesos per day, including all the services as well as basic care.
Now, you know, there are a lot of concerns and issues actually regarding this particular topic, because families would always say that, you know what, we're 6 brothers and sisters, so, you know, we can do the shifting on our own. And where does the whole nursing home idea come into play?
If you look at home health care, the home health care will then assist the 6 brothers and sisters to take care of the elderly at home. If you look at the nursing home, when they usually kick in is, you have 9 million Filipinos, I believe,
Yes.
working abroad. So sometimes they have parents here and they're not capable of taking care of them anymore because they are abroad. So they bring their parents to a nursing home to ensure that they are growing old in a good environment. Then we have elderly coming back from the US, from Europe, and also Hawaii a lot, that decide to go to a nursing home here because it's a lot cheaper than in the US. Another factor is if the elderly endangers himself or endangers family members, meaning to say they get aggressive, they tend to fall, they tend to run away because they tend to be confused when they have Alzheimer's dementia.
I see. So actually the environment of the nursing home is a really safe environment, away from all of these pointed tables and utensils and all of that. So
yeah, I mean, I know that it's not in the culture, this is what we always hear, it's not in the culture of the Filipinos
Yes.
to bring their parents to a nursing
nursing home.
home. The nursing homes here have been set up for foreigners, but 90% of the people inside are Filipinos. As much as it's not in the culture yet, what you can basically see is a change towards the cities, and in the cities you live in usually smaller condominiums. You don't have the space anymore to take care of your parents, as well as when it really gets dangerous for the elderly themselves. Then that's where usually is a change towards nursing homes.
And you did mention a while ago, like when the family members don't have the appropriate knowledge and training
Correct.
to take care of the particular loved one.
Correct, yes.
Okay.
I mean, this is where you usually require at least a 6 months training for a person to be really capable of taking care of a senior.
Wow. 6 months training program.
Yeah.
Okay.
In Germany it's 3 years, but the crash courses, you can say, can be about 6 months.
Okay, so you're going to talk about all of these other updates regarding the Retirement Healthcare Coalition, and also, again, important updates concerning the nursing homes and, of course, home healthcare. So we'll take a quick break. When we return, more updates, so stay tuned.